Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. So today's discussion ties in somewhat with the last week. We talked last week about inflammation. And one of the signs or symptoms of chronic inflammation is pain. Remember, pain, swelling, redness, and heat. Chronic low-grade inflammation. Today our main topic is on pain. And when I thought about doing this class, I thought, so what is of value to you to talk about pain? And to me, that's a challenge to make this hour valuable to you. So I'm going to try to do that. I'm going to try to expand your concept of pain and the value of pain and the part that it plays in our life. First of all, I would like to say to you that, in my opinion, pain is can be one of the best gifts that God has given you to help you take better care of your body. If you understand pain the way I do and treat pain the way I do, pain will be your friend. So if we ask the question, is pain a blessing or a curse? My opinion is almost always it's a blessing. Now, it can be a curse to you if it gets out of control. According to the CDC, if we make a list of the top 10 causes of severe pain, what do you think would be at the top?
Headache.
Pardon?
Headache.
Headaches, that's in the top 10.
Back
Pain, sciatica, leg pain. How about childbirth?
What? Childbirth?
Childbirth,
Right.
it's not in the top 10.
No,
And it's
because it's
not.
natural.
I
Because we
thought,
forget about that pain.
I thought it would be in the top 10 because a lot of times people say, oh, it doesn't hurt about having a baby. But part of that is because of the purpose of pain. When you have a baby, like it's worth it. It's worth it. It's going to be worth it.
So what is the number one?
The CDC does not list the number one. They list only the top 10.
Oh.
And no order. I'll look and see if I can find an order. And it's different. It's different for a reason. I'll tell you what I think the reason is. Pain is perceived differently with different people. A lot depends on the pH balance of the body. I've told you many times that an alkaline body heals better and faster than an acid body. That's why we do the simple test of checking the urine pH in the morning to monitor over time the acidity of the body. And The urine really doesn't tell the acidity of the body, but it shows what the body's throwing out. And if it's always throwing out acid, then we can assume that the body has too much acid and is trying to get rid of it. We had a discussion about water at night. And being acid and peeing a lot. If you have to pee a lot at night, and then drink more water.
Yeah.
Don't drink less so you don't have to pee less. Drink more water to get the acid out of your body sooner. And drink more water early in the day to dilute the toxin in the body.
Would something like that help with like acid reflux and stuff like that?
Acid reflux is a different problem.
Okay,
That's not because the body's too acid.
okay.
It's because of misaligned vertebra in the back, or too much toxin in the gut, which pushes the gut up and causes the valve at the top of the stomach to open. You get the leakage of the acid back up
Okay.
into the esophagus. Now you have two choices. Welcome. You want to sit here or here, or get a chair? Good to have you.
Thank you.
That's a good question, but that's a different problem.
Okay, just curious.
So back to different perceptions. I'm going to pass around the note paper. It has a diagram. You can pass that way. I think I'll give you the next one. There should be plenty. It has a diagram at the bottom. When people go to the doctor, they like to know about pain. The number one reason people go to the doctor with pain is back pain. Number two is neck pain. Back and neck take most people to the doctor. And you've learned from me many times, that back pain, low back pain, and neck pain is almost always, not always, but almost always a posture problem. Head, forward, posture. When the head goes forward, the neck automatically tightens. When the torso goes forward, the low back will automatically tighten. When the low back and the neck tighten, they get overworked and they get stretched. When they get stretched, they get pain. When they get overworked and overstretched, they start to give way, so they become more weak. Keep in mind, a long muscle, a muscle that's longer than normal is painful and weaker and stiffer. So whenever you have a tight muscle, the key is to shorten it and mobilize it. Now, what do doctors do when people go to the doctor with neck pain and back pain?
Stretch you.
Pardon?
They usually try and stretch you a lot of times.
They do what?
Stretch.
Yes, yeah, a chiropractor will do that. Sometimes even massage therapists. If you go to a real doctor, they give you a pill. And the pill is for what?
Pain.
Pain and a muscle relaxer. what the muscle needs is motion. Motion. And more appropriate balance, and alignment. If the muscle is positioned properly, it's relaxed. One of our sons, Andy, worked out hard as a football player. Ran fast, worked out very hard. He could work out for an hour and a half with the boys, come home, and his muscles would be tight or loose?
Tight.
Loose.
Loose because they're stretched.
Why?
It worked himself.
Because he was aligned. His body was where it needed to be. He could be completely relaxed. And if Denise laid him on the table to do massage, she would say, I can't find any tight spots. And he would smile, and say, that's because I'm aligned. Does that make sense?
Yeah.
Okay, now back to pain. And different perceptions of pain. You have the hand out in your hand. The first thing we should differentiate with pain is it acute or chronic? And acute means what? It's brand new. It's new. Chronic means it's been around the whole, well, the CDC reports that they predict that about 20% of the population of the United States live in chronic pain. And the pharmacy says, sweet. Because we can make all kinds of drugs that deceive the body to thinking it's okay.
And the surgeon knows it too.
Yeah. Yes, especially if you have intense pain. So, another question, and we'll go down this list relative to pain. Is it local? Is it a single joint or a single area? Or is it more regional? Is it systemic? Many times, the systemic problem is called a referred pain. I'll give you an example. If you have a kidney problem that's significant, it's not just working hard, it's been infected or attacked or you've abused it by dehydration, and you have back pain, you can lay on the table and do massage or chiropractic or whatever you want to do to align the back, release the tension, relax the back. And while you're laying on the table with no physical stress, the back will tighten back up. That's an indication of an organ problem. Now, I tell you that for your benefit. If you're laying in bed and you have a hot pad or you've done something, a massage or stood in the T-zone, and you have an area of pain that's significant, that keeps tightening back up, you probably have an organ involvement. Now, what if you took a pain pill for an organ involvement caused pain? Do you help the organ? No. The organ continues to suffer. In your body, if you take a pain pill, then you're basically shut off the message going from the organ to the brain. And that's very common. I've had people who take Tylenol, for example, for prevention of pain while they sleep. And I think that's one of the worst things you can possibly do. Because what happens normally when you sleep? You heal. That's the goal. You heal. See, that's why you take the time to get ready to go to bed. You try to get relaxed, mobile, balanced, lined up, hydrated, go to bed to heal. Now, any questions about that?
Oh dear.
Sometimes there's what's called a referred pain. That's what I just talked about, the organ. It's due to a system problem. Now, we have different causes of pain. I would like you to think beyond this handout. I would like you to think about the triangle back on page 27 in the book. Is it possible to have pain that's not physical?
Yes.
Like
Yes, it is.
what kind?
Well, emotional pain, sometimes you feel it physically when it's not.
Emotional, the cause of the pain is emotional.
Yes.
True. That's very common. It's more common than you think. Anytime you have a spouse problem, a family problem, financial problem, pain overlaps into the other parts of the triangle, so that your behavior physically, your organs digest food differently. If you have significant emotional overload, everything works at a lower level. I'll give you a personal example. We lost our daughter, Danielle, that's the one in the middle, the little one, to drowning on New Year's Day years ago. She was 18 months old. That was a tremendous emotional trauma. Neither I nor my wife could sleep. We had a friend in the ward who was a pharmacist. 2 days after the death, he showed up at the door, knocked on the door and said, "Take these tonight." We had no idea what they were, but they caused our body to shut down and relax so we could get some sleep. He knew that if we didn't get it, we'd get sick from the emotional overload. This year, when Audrey was having her COVID and almost died 3 nights in a row, for me, laying by her, knowing that she could leave me any minute, that was a very expensive emotional overload to me. So I can relate to that. Now,
Doctor,
yes,
sometimes it takes the person going through these severe pains of loss a good year or two to feel like you're healing. It's not a couple naps or anything like that. It does take a while.
exactly.
And we're all different.
And sometimes it takes longer. I have a lady right now that comes to see me. Her husband died with COVID over a year ago. And she went to a funeral within the last couple of weeks. And finally was able to release most of the grief that she had been carrying for more than a year. So it takes a long time. Now, so let's go look at the pictures on the bottom of this page. Generally speaking, and I will ask you occasionally, so other doctors, you have pain. How intense is it? This is one of the many pain charts. There are a lot of different ways to indicate pain, but generally they classify them from 1 to 10. I'll give you my opinion of how to deal with them. If the pain is between a 5 and if the pain is between a 4 and a 6, whatever it is, and it feels like it's getting worse, stop doing what you're doing and back out. You don't want to allow your pain to progress to a 6 or 7 or 8. If you can stop it, what are some of the ways you can stop emotional pain? You can pick a new channel. You can think a new thought. You can get in a different mind frame. So you do that by being with other people and talking about different things to get your mind off from whatever the emotional trauma is. What if it's structure? If you're working in the garden and the pain, you get low back or neck pain, and it turns into a 5 or 6, what do?
You said stop.
So you stop. Try to prevent pain from going above a 6. Here's why. Tissue tolerance. That's the key. If you exceed tissue tolerance, you do new damage to already stressed tissue and can cause you to heal more slowly and heal less with less quality of repair. Now, if you do an activity, whether it's structure or chemical, like eat food, today and tomorrow you feel bad, you exercised, you worked in the garden, you might have read the scriptures for 5 hours instead of 2. Tomorrow you have a headache, you did too much. So the general rule is this: if you're 2 rules. Number 1, if it's a 5 going to a 6, you stop. If you do the whole thing, no real pain, but tomorrow you have pain, it's a 5 or 6, you cut what you did at least in half. You do half as much. Did that make sense?
So if the pain doesn't hit till the next day, then you know you overdid it and you cut in half what you overdid the
Bingo.
next time you do it.
Exactly right. So you don't need to stop doing it completely. You just cut it in half and do it again. If you have no pain the next day, then you know about what your tissue tolerance is at that point in time. Now let's go back to the pictures at the bottom. And the confusion with the CDC on the 10 most common pains. Shingles was on the list. Shingles. Headaches was on the list. Cluster headaches. Childbirth was not. Sciatic was, neck pain was, back pain was. So when I or another doctor ask you, how bad does it hurt? That's kind of the idea. When I hear a patient say, well, about a 13, usually that person has an emotional problem. And they need and want more attention to whatever's going on. Any questions on what we talked about so far? Okay, we're going to go to the next handout. So when we're passing this out, I would like you, a couple of you, if you wouldn't mind sharing a type of pain that you've had that was very significant, if you've had one.
So about a week ago, I woke up and had a severe headache. I don't hardly ever have headaches. I think there was something in the back of my head. I tried everything, and as the day progressed, it got worse and worse. And Karen says, well, you need to take this. Give me a pill, I don't know, it was Tylenol or ibuprofen, I think it was. So, and within an hour and a half, the pain was pretty near all gone. And then the next day when I woke up, it was totally gone. I never had any. When the back of my head was sore, I didn't have any pain, like a headache.
So you have no idea what it was.
I have no idea.
Came and went. Okay, so one of the characteristics of pain is location. Like where is it? What type of pain is it? How bad was that?
It was 9 or 10.
They feel like a squeeze, pressure, pulse,
Yeah,
both.
both, and it was blurry. My eyes started getting blurry. I couldn't see very good.
Okay. Well, what did you do to help it besides take the pill?
Went to bed.
Is that a good thing to do?
Mm-hmm. I would think so.
What do animals do? Animals,
When they're hurt?
wild animals in the kingdom of the animal kingdom, when they get sick or hurt,
They lay
Lay
around.
in the shade.
what?
Lay in the shade.
They drink water and they lay down, go to sleep. They wait. Sometimes they wait for a longer time. Anybody else want to share pain?
I had that pain, you know, in my groin.
Yes.
It was just the sharpest pain ever.
Sharp, meaning like a knife, a needle,
Yeah,
both.
both, really.
Yeah.
It was there and it hurt like heck. But prior to that, I was mad at my husband. So, I don't know. I just went to open the door, get back in the car and emotionally, yeah. So, I don't know, but
It's very, very common for overlap of pain. Keep that in mind.
I've had 2 different pains. One being 74 years old, labor pain. And it had to be the uterus, it had to go, it was diseased. Now I can't even think of the other one, brain pain. But the grief pain, back to that, after you come out of that situation, my body had 12 sicknesses, illnesses throughout the following year. It was like saying, it's my turn now, because I was the caregiver. And I got it, you know, I had it.
So would you say that was the sicknesses were partially caused from the emotional overload of taking care of other people?
Oh yes,
Oh, yeah.
definitely, that year. And then the other was just diseased and gallbladder pain, you know, that gets diseased and has to go too,
Okay,
so.
yeah.
So, mine was sciatica. I just turned over in bed and one day and I couldn't hardly get up, you know. I mean, even going to the bathroom and getting up, it made you cry and everything. So finally, I went to the chiropractor. I have a really nice, wonderful chiropractor that doesn't kink her neck or anything. And finally, I ended up at the, not ER, but the Instacare, because I went to get, I can't remember the drug they give you sometimes to,
Muscle relax?
no, it wasn't a muscle relaxant, but it just sent me, they wanted me to take it for 10 days, and I can't think what it's called.
Hydrocodone?
Hmm?
Lortab?
No, it wasn't any of those.
She had sciatic pain and you took a pill and messed up with her brain.
Yeah, well, and I didn't notice a lot eventually the pain went away after I'd taken it about that 10 days. I guess most of the time they only have you take it 7, but that particular doctor at the Instacare had me take it that, but it just messed up my chemical thing at the time. I thought, oh my gosh, I will never take this again, because I'm sensitive to medications anyway, but
Thank you.
is that, so what would cause a sciatica? I mean,
Well-
how do you help a sciatica?
From my opinion, when you start talking, you said you woke up and turned wrong.
Yeah, I just
and
kind
had
of happened to
severe
turn
pain.
and it just like it shifted something there.
We talked last week about an acute manifestation of a chronic problem. So I would bet everything that you have had a chronic
Something.
tissue deterioration, and the motion was an acute manifestation of a chronic problem. It's very common as a treating doctor that people would come in and say, it can't be bad, I haven't had any pain before, but all I did was sneeze. Well, if that's all you did, that's proof in my mind of an acute manifestation of a chronic problem.
I believe it was chronic, I honestly do.
Well, I'm sure it was. And again, the worst thing you can do, in my opinion, is take a pain pill and keep aggravating the tissue that's in trouble. That's very, very common. And the surgeons love that. Like, we're going to treat your pain till they can't tolerate it. So it's going to go from 5 to 6, eventually 7. When it gets up to an 8, you'll be in my office praying for me to cut you and do something right now. And that makes it easy sales pitch for a surgeon. Like, sweet, today's the day.
I have this knee pain kind of, not terribly bad, so I didn't pay much attention to it. And then I could feel it in my hip, and I thought maybe I better do something. And I came into you. Well, no, I didn't come into you first. I tended a grandbaby for a week. It was very heavy, and I lifted her way beyond tissue tolerance
Yeah.
until by the end of the week I couldn't even walk.
Yeah.
And then I came in and you worked on it, and then I went into physical therapy. We're still working on it.
Yeah.
I felt it manifest in my ankle at times, and then just the last week or two it started into my lower back, and it's like, and I could tell it was related. And the lower back one, when I'd go walk, after I'd walked about a half mile or so, it would ease up and it would be fine. I mean, it hasn't ever been excruciating except the week I was tending the baby. The rest of the time it's just been irritating. But the therapist said something interesting yesterday. She said, it's good if it works up higher and into towards your spine, because it means we're getting closer to the source of the problem or something. And I'm going, what? So she worked my back and said I had some discs that were out or something, and that really helped. I felt a lot better. I can still feel the knee, the hip, and that back. They don't hurt, maybe like 1/4 or something, but I can feel them, and they make me nervous.
It should make you nervous.
Yeah,
Because
but it's been a long time.
right. So you have a chronic, complex problem that has a spread by compensation and adaptation
That makes sense.
to another area. And you said two things that I want to comment on. Number one, if you have a pain that's, like you say, stiff, and you move it around and the pain goes away, you can think most of the time it's probably muscle. Okay? If it's joint, then walking the half mile, you aggravate it.
Yeah.
And from what you said, you definitely have both in multiple areas. The low back, the hip, the knee, the ankle, the foot, and guess what? The shoulder, the neck, the head are all involved in compensatory adaptation. Right? Remember those words, compensatory adaptation. The body will always adapt the best it can by compensating. When you compensate, you use different motions, use different tissues. Your body will move you away from the tissue that you've exceeded tissue tolerance and now aggravate more new and different tissue. So the bottom line is, again, back to the leaky bucket with the holes. You want to put the heavy grandkid down. And next time, when they say, Grandma, would you tend my baby, you say, no, thank you. Last time I did, I got in trouble, and you're still paying for it. You'll pay for it for probably months. Take a long time to undo the damage. Now, let's go back to the word adaptation. We've talked about this in the past. Adaptation does not always mean recovery. Adaptation means adaptation. Think of you farmers, think of driving a big heavy truck over an old rickety bridge that's breaking down, and the bridge breaks down. Did it adapt? The answer is yes, it adapted. It did what old bridges do when they have too much stress. They break down. Your hip, your disc, you mentioned disc. A disc is a big deal. A disc is critical because the disc is what carries the weight of the body. And disc adapt by dehydrating. Think of a disc like a sponge that you squeeze. If a disc gets imbalanced and you squeeze it, it becomes more dry and more brittle. You understand? More brittle. And the center of the disc, the nucleus, will bulge and sometimes leak and put pressure on nerves that go into down the leg, the sciatic. And then you have another happy surgeon, because it can go in there and clean that off. But the disc will never be normal unless you do what? Balance it, put it in motion, and realign it. I saw a fellow today who has a disc problem, and one of the things I recommended for him to do is get down on his hands and knees and crawl. He spent a lot of time in a big garden. He's in a perfect spot to do active self-care by crawling, letting his low back sag. Okay, follow me. When the low back sag, when you're on your crawling position, do the muscles get shorter or longer? Shorter. Because the curve.
Like an old mare.
Like an old horse.
I resemble that comment.
When the belly sags down, the back sags down, think of the curve in the low back like a bow and arrow. The bowstring gets shorter. When it gets shorter, it relaxes. That makes sense? That's good therapy. That's good therapy for
So I'm
any
gonna go out and crawl in my garden.
Yes.
Right?
Yes.
Way better than bending over.
Yes.
Say that again.
Way better than bending over.
Why?
All right.
Why?
Because when you're bending over, you're lengthening all of those back muscles, all of the muscles along your back from your neck down to your ankles. If you crawl, you're shortening them. You get on your hands and knees, shorten those muscles, and you can work longer in the garden.
One of the best investments you'll ever make if you have a garden, go to Home Depot and buy you knee pads.
I have some.
Put them on, go to your garden, get down on your knees, and spend a lot of time on your hands and knees moving around, shortening the muscles and relaxing them.
Does that help your hips too?
Anytime you help the low back and sacrum, you improve the balance and alignment When you say hips, the femur head.
Yeah, just right back in here.
Okay, do that again.
Back in here.
That's sacrum. Yes, yes, that's very good for that. You don't do the sacrum slide, do you?
Yeah, you're,
Is that the one where you,
Yeah,
yeah,
she
she
has
taught me
been
how to
doing
do that.
Good. That's very good
I
for
do
that.
do that.
That's very good for that also. When you turn your feet
And
in.
then right somewhere.
Yep. Okay, let's go to the true or false. Pain can be classified as a teacher.
True.
Can be. True, yes. Is that always? No, because sometimes you just ignore the teacher. God gave you pain receptors to warn you when you get
Something.
to a point where it's exceeding to shetans. And sometimes, like, you take a pain pill and go work in the garden so you don't hurt. You go work in the garden, you take a pain pill, then you come back in because you overworked. You didn't listen to the teacher. The teacher is a gift to you from God. Is it possible to benefit from pain?
Yes.
How? Why?
Teaches you.
Teach you to learn.
Be careful what you're doing. What I just did
To
wasn't
not-
a good idea.
That they're not 10 grandkids.
Or wait till they can walk.
So you don't have to pick them up, huh?
I remember when we'd come to visit my parents, my mother would say to me and to my boys, "Don't let your boys jump on me."
Oh,
They would always like to jump on grandma, and she couldn't tolerate that. Number 3, a nerve can lose its trustworthiness when pinched, stretched, twisted, or dehydrated. True. What does that mean?
Well, it doesn't always function then as well as it would otherwise.
Exactly, and sometimes you may have a organ problem because you overate. And your organ sends a message to the brain, like, stop eating, you ate too much, you need to go lay down, you need to take an enzyme, you need to do something. But the nerve that goes into your back is pinched or twisted, the message never makes it to the brain. So your brain doesn't know what's going on down there. Same with the back. Number 4, acid alkaline imbalance and sugar excess modify nerve function. True.
Can I ask you something on that? You know, on the acid alkaline thing, how much really of the sodium? Baking soda would you put in your water? I mean, I don't mind drinking that. I've done it before, but
Okay,
to alkalinize your body.
let me give you the correct answer. Whatever you need to help you become more alkaline, so that when you test your urine pH in the morning, it's above 6.5.
Okay.
Now, I didn't tell you the amount because the amount will be different
For everybody?
and it changes depending on what you eat. If you eat a lot of green stuff out of your garden, you're going to be more alkaline. If you have pizza, you're going to go acid. So, what's the guide? Urine pH, first in the morning. Is that checking the acid of the body? No, it's only checking the urine. But the urine is a sign of the body's waste excretion. Number 6. No, 5. Pain disrupts the communication between brain cells and can change personality and also one's ability to process emotions.
True.
Totally true. I used to have ladies who would come to me and say, My husband told me I need to be treated. I said, why is that? Because I was becoming a witch. And when I'm not aligned, I behave differently. Now, the truth is, that's true for all of us. Six, ignored pain turns off body symptoms, which can lead to other health problems, and like fatigue and muscle weakness. That's true. Now, let me comment on turns off other symptoms. And you can all relate to what I'm going to tell you. In the body, there's a process called the reticular activating mechanism. That's a fancy word for you get used to it. So you buy a house by the railroad track, and the trains go by 6 times a day. And you think they go by 10 times a day, because they're always hearing trains. And after you live there a couple of months, your friend comes over, and the trains are bugging them, and you say, what trains? You're used to it. Your body does the same thing with pain and many of the things that cause malfunction. Now, I say malfunction. Think back what I said a few minutes ago about adaptation. Adaptation is not always repair. Adaptation can be, and probably is often, breakdown. You adapted because you broke down. That's what's going to happen to the disc and the hip and the nerves that are pinched. They will break down because they're adapting negatively to the stress. Did that make sense? So don't confuse adaptation with recovery. Adaptation is a compensation. And sometimes it goes, you get a little better, then you get a little worse. You get a little better, then you get a little worse. You get a little better, then you get a little worse. Well, which way are you going? Are you really getting better, or are you really getting worse?
Really getting worse.
Sometimes.
Oh.
Sometimes you're really getting worse. If you're really getting better, and then you drop a little bit, and then you get better than that, and you drop a little bit, it's kind of like what we wish the stock market did, right? Up, down a little bit, up more, down a little bit, up more. That's the direction you want to be going. I
call it a different plateau. We want to get to a higher plateau. We want to elevate your feet. We all go up and down. We all have good days and bad days in each corner of a triangle. But the goal is to get bigger and stronger and move up to a higher plateau to become better. Okay, other symptoms. You can have we can say other systems, other body systems. Like you can develop a lung problem, a liver problem, a gallbladder problem, a kidney problem, because you ignored pain. When you have pain, that's an indication, a God-given notice something is in need of attention. If you listen to the teacher that's within, most of the time, pain is good. It only becomes not good when you ignore it and it becomes more significant, or you try to mask it so that the body then can't recognize the problem and fix it. 7, according to CDC, 20% of the population live with chronic pain. True. 8, pain has several dimensions or core aspects like physical, sensory, behavioral, social, cultural, cognitive, affection, and spiritual. true. All of those are affected. Does that mean you become less affectionate if you have pain? Yes. Do you become less cognitive, less smart? Yes. Do you become have less capability of being receptive to the spirit? Yes. It can affect all of that. Number 9, the 5 most common types of pain are acute, chronic, neuropathic, nociceptive, that merely means tissue has been damaged. You hit your thumb with a hammer. Radicular or referred. That's true. Number 10, fill in the blank. So this is where you get involved with description. Describe pain in terms of its characteristic. What is important? You said stabbing, right? What kind of pain? So stabbing, dull,
How about burning?
burning, pardon, throb. So doctor, I want to know, is the pain intermittent? Does it come and go? Is it unrelenting? Unrelenting means it's there all the time. It doesn't matter what I do. I can lay down, I can sit down, I can eat, I can sleep. It doesn't change. Tingling. What else?
Sting.
Pardon?
Sting. Sting.
Sharp? Sharp?
Numbness.
Numb? There are more than we have space for. Many different kinds of pain. Number 11, no pain is always good. False. Can you have major tissue pathology and have no pain?
Yes, you can.
For example,
Well, there are some people that, for instance, don't feel like if they step on a piece of glass or something like that, they don't feel any pain, so they think they're okay and they just go on with life.
okay, what's another example?
Larynx can be damaged, the vocal folds really easily without pain.
Without pain.
Tumors or cancer.
What?
Tumors or cancer.
You can have cancer for 6 years with no symptoms. None. You can have a heart attack that's the first symptom. The stroke I had my first stroke was in 2016. I woke up in the morning, I felt fine. I get in the bathtub, I felt fine. My routine. I was going to do it, and then I was going to shave. I went to pick up my razor, and my hand didn't work. My hand didn't work. I couldn't pick it up, and I thought that's not a good thing.
What's going on?
Something's wrong with me. So I instinctively tried to talk to myself, say some words. I couldn't talk. So I got out of the bathtub and went up and woke Audrey and said, we need to go. And we went straight to the hospital. And I had no pain. They took me in and checked and said, "You've had a stroke." I said, "Yeah, I know." I didn't say that, but in my head. And they said, "When did you have it?" Because that's important
What they do.
on what they can do.
Oh,
And I didn't know when I had the stroke. It could have been right when I got in the tub. It could have been 11 o'clock at night. I had no pain. So because of that, they could not give me the stuff they give to dissolve the blockage in the brain. And that, because of that, it took me 2 years to recover. When we moved here in 16, I had another stroke. I was with a patient, and all of a sudden I noticed I couldn't talk like I had been. She was a nurse, and she said, "You're in trouble." We called the ER. We got in the car. They knew I was coming. I went to the ER at Ermac. I knew I had had the stroke within a half hour. They gave me the stuff. One night came home. So it's important when you have a stroke. See, strokes and heart attacks kill you. If you feel like you have an elephant standing on your chest, like bad, go now. Don't mess around. If you think you've had a stroke, you do simple things like put your tongue out, move it back and forth. Your tongue should be able to go in and out, side to side. If you can't talk, if you lose feeling, go now, with no pain. Okay?
Isn't there a poster I see all over that says fast? It's face, arms,
Act.
F-A-S,
Speech.
speech, and then time, meaning hurry it up.
Yeah.
Isn't that the three things, face, arm, and speech?
Something different yet.
Yes.
Okay.
And that's one good thing about modern healthcare. They can help you live in an emergency, not make you healthy. I've been involved with the medical people for now since 2016. They've done nothing to help me maintain, to improve my health, only to keep me alive. It's what I've done at home that's helped me to become
It's all up to you.
better and better every day. So back to pain. I encourage you, if you have pain, do a self-assessment and ask simple questions like, what could be the trigger? Is it emotional? You know, did I say something to somebody or have something said to me that hurt my feelings? Did I abuse myself by service to my family, by yard work? What did I do to trigger it? So try to identify the trigger, and then try not to pull the trigger again. Some of you have multiple triggers.
I do.
Multiple triggers. In the book I talk about multiple deep holes. I saw a lady yesterday whose husband has been here. He finally talked her into coming. She said, I feel guilty for coming because I don't have anything wrong with me. I started to check her and said, I have a couple of surprises for you. One of which was, people, they get used to things. I was checking that, I saw some varicose veins in her leg. I said, you have bad varicose veins. And she said, oh, I've had them for a long time. That doesn't make that good, doesn't make it okay. I said, varicose veins it's a serious problem. To me, it's a sign or symptom of chronic low-grade inflammation. So I asked a couple more questions, like, well, do you have hemorrhoids? Oh yeah, a lot, but they're bad. Do they bleed? Yes. Well, that's a whole new issue. It's a very good thing that she got checked, because I think we can change her course of the next 10, 15 years by putting her back on a better trail to move her to a higher plateau. because she was not going up, she was going down and had no significant pain, but she had significant symptoms. Thank you for coming.
Thank you.